When you have a chronic illness like high blood pressure or diabetes, you go to the doctor, right? But when it comes to mental illnesses like clinical depression, it's just not that easy. Many people don't get the treatment that they need, thinking they can handle it or it'll just go away. And suicide is now one of the leading causes of death here in the United States. And Brightside's Jenny Dean is looking at new ways to treat depression, Jenny, and some of these new methods are starting to give people hope.
Yeah, it really is. You know, there hasn't been a whole lot of new treatments for depression in a very long time. So with depression, usually the first protocol is to recommend counseling and then antidepressants. They can take a long time to start working, but if you're in the depths of depression, you may not have that kind of time. In the last few years, though, there's an old drug that's proving to have a new use.
It's like going down a dark alley, and it keeps getting darker. It's desperate. It's desperation. It feels hopeless, and it came to a point of crisis. Honestly, if you would have asked me, could I change overnight like that? I would have told you no. There's no way.
Kelly Choi had been suffering from depression for years. She had tried everything. It took one shot of ketamine to bring her back into the light.
Ketamine is a anesthetic drug that's been around. It's been approved for 50 years. It's used in operating rooms every day.
A few years ago, it was discovered that this same drug can have an effect on mood. So psychiatrists started prescribing it off-label to people suffering from depression. Dr. Ashraf Hanna at the Florida Spine Institute was one of the first doctors in the area to offer IV ketamine infusion therapy 8 years ago to treat chronic pain. He now uses it on patients for many conditions, including depression.
So even one of the more recent theory for depression is also inflammation of the brain. And this is actually where ketamine came in. Ketamine is actually the most potent anti-inflammatory to the brain.
Tampa psychiatrist William Dudney frequently prescribes ketamine in the form of a lozenge to patients. It's something he now offers as an alternative to antidepressants. Those medications often have undesirable side effects like fatigue, weight gain, and loss of intimacy. But most concerning, they take a long time to work, sometimes 2 to 6 weeks. Ketamine doesn't have those side effects, and it works fast.
And it can work within a matter of days or hours, which is a huge advantage.
Ketamine is banned.
In all the decades that I've been practicing psychiatry, I've never seen anything where the enthusiasm is so positive and the outcomes are so good.
7 months ago, Kelly says she would never have been so open about her depression.
But because this has changed my life so much, if there's one person that would hear this and know that there's hope, then I would do it again and again.
Now, we do want to stress the importance of seeing a psychologist or a psychiatrist if you're suffering from depression. That's where you would get a prescription for ketamine or be referred to a ketamine clinic, of course, after a thorough workup. Again, it is prescribed for depression off-label. That basically means it's being used for something other than what the FDA approved it for. And it is fairly common, though, for a lot of medications to be prescribed off-label by your doctor.